defect that allows blood to flow back and forth between the left and right atria of the heart through a hole or defect in the interatrial septum. The interatrial septum is a thin piece of tissue that should normally completely separate the right and left atria. If a person is born with a hole or defect in the septum, oxygenated red blood from the left side of the heart is allowed to mix with deoxygenated blue blood from the right side of the heart.
The symptoms: hair murmur, shortness of breath, fatigue, swelling of left, heart palpitation or skip beats, frequent lung infection, stroke, and bluish skin color.
Or a hole between the atrial chambers or receiving chambers of the heart. The symptoms really depend on how big the hole is. The symptoms, there may be no symptoms, and it's actually quite common for a patient to have no symptoms and for this to only be picked up on a routine physical exam or a routine echocardiogram. If the hole is big enough, then it can cause symptoms of congestive heart failure, mild congestive heart failure, where the patient feels short of breath or develops edema, buildup of fluid in the body. One other concerning potential symptom of an atrial septal defect is a stroke or a mini stroke. Because the hole is between the right and the left side of the heart, small blood clots or other types of
The cause: an atrial septal defect allows freshly oxygenated blood to flow from the left upper chamber of the heart into the right upper chamber of the heart.
There are many causes of birth defects, some of which we don't know. We do know that there are classes of drugs, like SSRIs, antidepressants, that cause a whole host of birth defects, including neural tube defects, craniosynostosis, limb reduction deformities, missing limbs, and spina bifida and other types of birth defects.
Risk factors: it's now known with atrial septal defects occur, but congenital heart defects appear to run in families and sometimes occur with other genetic problems such as Down syndrome.
Cardiac catheterization, a thin tube catheter, is inserted into a blood vessel in the groin and guided to the heart. Through the catheter, a mesh patch or plug is put into place to close the hole. The heart tissue grows around the mesh, permanently sealing the hole.
Deborah did wonderfully.
Complications: a small atrial septal defect may never cause any problems. Small atrial septal defects often close during infancy. Right side heart failure, heart rhythm abnormalities, shortness, life expectancy, increased risk of a stroke.
Having a hole in the interatrial septum is you do allow communication of the right side of the heart to communicate with the left side of the heart. And one of the theoretical things that can happen is a clot can come up from the right side of the heart, pass through the hole, and then it has the ability to go anywhere in the body. And if the clot makes its way up to the head, it obviously can lodge in one of the vessels and cause a stroke. And so that's one of the more devastating complications that we do see from atrial septal defects.
Correction involves
Atrial septal defect and pregnancy. Most women with an atrial septal defect can tolerate pregnancy without any problems. However, having a larger defect or having complications such as heart failure, arrhythmias, or pulmonary hypertension can increase your risk of complication during pregnancy.
Side that's too small. It's very important that babies have a large connection between the two upper chambers of the heart. So in this diagram, what I'm talking about is the hole here between the upper two chambers that all babies normally have, and is very important that babies with hypoplastic left heart syndrome have. In a very small percentage of babies with hypoplastic left heart syndrome, this hole is either too small or even non-existent. And in those babies, this can create problems with the baby's lungs. In babies that the hole is too small, the blood will come back from the lungs to this upper chamber, and it has nowhere to go. It can't cross across that hole, and it can't go into the left side of the heart that's too small.
The test. Echocardiogram is test that use sound waves to create a moving picture of the heart. It is often the first test done. Other tests that may don't include cardiac catheterization, coronary angiography, Doppler study of the heart, ECG, heart MRI, and transoropharyngeal echocardiography.
Your physician may first uncover an atrial septal defect during a regular checkup while listening to the patient's heart using a stethoscope. Classically, a patient will have a fixed split-second heart sound with an atrial septal defect. Often, a systolic flow murmur is heard over the pulmonic valve area on exam. Atrial arrhythmias should be further evaluated for a potential intracardiac shunt. Atrial septal defects are confirmed with an ultrasound exam of the heart, an echocardiogram.
Well, typically as people get
Diagnosis. Your doctor may first suspect an atrial septal defect during a regular checkup. If he or she hears a heart murmur while listening to your heart using a stethoscope, or an atrial septal defect may be found when an ultrasound exam of the heart is done for another reason. Treatments. ASD may not need treatment if there are few or no symptoms, or if the defect is small. Surgery to close the defect is recommended if the defect causes a large amount of shunting, the heart is slowing, or symptoms occur.
In a hole in the heart is that if it's a big enough hole, blood will go backwards through that hole, through the hole from the left atrium to the right atrium, and that makes the heart have to work harder to get more blood forward through the heart out to a patient's brain and organs and legs and arms. So that's the problem. And what happens with this extra volume is that they can develop problems with having a bigger heart because their heart has to get big to accommodate this extra volume of blood and extra work. And it can also cause long-term damage to their lungs if they have too much blood going backwards to their lungs. And so typically if the defect is big enough or the patient has symptoms that we've already described, those are indications for having it repaired.
Prevention. In most cases, atrial septal defect can be prevented. If you're planning to become pregnant, schedule a preconception visit with your healthcare provider. Getting tested for immunity to rubella, going over your current health condition and medications, and reviewing your family medical history.
Correction involves plugging or patching the abnormal opening between the atria. This is done in the cath lab and utilizes cardiac catheterization.
Our patient Deborah is a fascinating patient. She has a sister that actually had a hole in her heart that was repaired down in Alabama surgically with a traditional open procedure. The surgeons down in Alabama had told Deborah she ought to have herself checked to see if she had a hole in her heart as well, because there is a small incidence of running in families, and she came to us. We evaluated her with an ultrasound, and she did in fact have a sizable hole in the septum of her heart. Even though she didn't notice symptoms per se at the time, she was having some evidence that the right side of the heart was getting strained. Her sister had a little bit of a prolonged course and had some difficult times, was back in the hospital, and ended up taking several weeks to recuperate from the entire procedure. And Deborah opted to go with the less invasive approach of placing a patch in the hole through the leg.
Thank you.